Are we live? Answer is, yeah, here's you. And how are you all?
Good, good.
Okay, we are live on Facebook. 1 second, we'll change the arena link in a second, and then we'll start. Prachi, is it done? Are we live? No, just the final check. So, hello everyone, welcome to Soul Talks. Today we have this amazing panel with us, and we'll be discussing on bridging the gap between cancer and mental health. The topic for our session is stamp out the stigmas in cancer, and we have a moderator, Sumedha, with us. Sumedha Tolani is a trauma-informed counseling psychologist, and she'll be here with us and moderating the entire session and giving her viewpoints and telling us more about cancer and mental health and breaking all our stigmas. Our wonderful panel will be giving all the answers to her questions and breaking all the stigmas for us. So over to you, Sumedha. Let's start.
Thank you, Akriti, for the introduction.
Ma'am, my name is Kavya.
Oh, sorry, Kavya. Thank you, Kavya. So we have gathered here today for a very important cause, which is to walk our audience to the patient-friendly side of cancer. And for the same, we have four amazing experts, Dr. Seema Kulia and Dr. Sushant Mittal, our medical oncologist, Dr. Vijay Kakkar, plastic surgeon, and Dr. Kanika Sood, radiation oncologist. So now when I say patient-friendly, I intend to point out the emotional turmoil or the intense emotional side of journey that the cancer survivors and their family members go through. And cancer itself is called a multidisciplinary field, जिसमें chemo, radiation, and surgery. There are so many elements that are already taken care of, that are already, patient is bombarded with so many terms, so many choices to make. But in the process, the emotional aspects, I think, is completely discounted, despite of the doctors and the professionals like taking care of the counseling part as well. But still, I feel that there is some sort of absence of a mental health professional who could actually walk in every aspect or be present in the every aspect of the journey. Wherever there are many little or big moments when the survivor or the family members found themselves helpless and lonely and confused in the choices in the process. So to begin with the process, just the very first stage, addressing the elephant in the room, I would like to ask Dr. Sushant, what elements are to be taken care of while breaking the news to the patient, or especially when it's a child? Because this is the moment I feel where entire life is going to change for them. उनके प्रॉब्लम का डेफिनेशन चेंज हो जाता है, प्रॉब्लम को देखने का नजरिया चेंज हो जाता है, लाइफ की प्रॉब्लम सडनली बहुत छोटी लगती हैं. So this is a first step with the address, first step where anxiety, panic, fear, all of this comes along while breaking the news. So how do you go about the process?
So whether it's a kid or whether it's an adult or whether it's an elderly gentleman, the emotional process is almost same. First of all, there is anxiety, then there is denial phase, and then comes the acceptance phase. So everybody as a human being goes through these phases. Even we as an individual also goes through these phases. So we have to take care of those phases while breaking the news to the patient or the relatives or the patient. Now there are guidelines set by the Western world which says that patient is to be told about the report and has to be given all the information, and then the patient has to take the decision as to what treatment they want. However, in India, it is not like that. In India, most of us don't tell the report to the patient themselves. we tell the relatives, we tell the parents, we tell the husband or the wife, whosoever is the closest one decision maker, we tell them the report, we'll tell them the treatment, and we tell them the prognosis. Because in India, it is very difficult for the patient to be educated enough or to be well informed enough to take an informed decision. So we have to tell the relatives, we don't tell the patient or the kid themselves. Gradually, during the course of time, they get to know that they have the cancer and this is the chemotherapy which is going on. And what we tell them is that they have some kind of infection, antibiotics are required, antibiotics are strong, so they will lose their hair, they'll have some loose motions or oral ulcers. In about 15% of the population, they are educated enough that we tell the patient themselves that you have this problem, and this is the cancer. We use the word cancer. You need chemotherapy or radiotherapy or and all those things. But in majority, if we tell them the word cancer or chemotherapy, they obviously get depressed and they lose their motivation and they think that's it, that sentence, and it becomes very difficult for the relatives and the doctor to treat the patient. In the kid, yes, it depends on what age group the child is. Nowadays, everything is available on the internet, so they read all information and then they develop their own myths and a set of questions they have in their mind after reading all those things. So we give them time to go through the literature and tell them ki, if you want to ask anything else, you can come back again or note down the questions and they rediscuss with us as to what all is the expected course of action in the future. So that's how we break the bad news. And it's not always the bad news. Sometimes, if the scans are good, we tell them that the report is good and they have to continue the therapy. And in many a times, when it's the palliative care, when the patient is bedridden or is terminally sick, then obviously relatives have to be counseled more rather than the patient because patient may not be in that state of mind to take the decision for themselves. So that's the Western guidelines cannot be fully followed in India.
Thank you for this wholesome answer. So, as you yourself said that you tell the patient with all the choices and they go and think about it. So, for bridging the gap, this is the main element where I also feel that the doctor, for the process of discussing the courses of treatment, because they are not well knowledgeable enough to understand कि किसमें क्या करना है, and they keep running between like run back and forth between the opinions, and यहाँ पे stress, anxiety, and the fact that cancer को दूसरा नाम ऐसा मौत की तरह दिया जाता है हमारी population में, it comes with a lot of fear. So यहाँ पे भी not just palliative care, even in the first stage where a mental health professional can go through the journey with them, I feel यहाँ पे हम एक gap को bridge कर सकते हैं. So ऐसी कुछ facility होती है where the doctor refers to the oncologist in the very first stage itself from the beginning of the process. Dr. Sushant?
We have counselors with us who counsel them regarding the various options, but definitely they are not well aware of the latest guidelines. They counsel them for how to cope up with this news, what the doctor is saying, how to interpret in simple language if they have any problem in understanding, what financial and social help can be given through these counselors. And obviously, some things if we are not able to tell them because of our busy OPD, then definitely they take care of those aspects as to make them meet patients who have already taken those that treatment, making them meet to the relatives who have taken those treatment and guiding them as to what is there in the future in next 6 months or 1 year what they can expect. So definitely we have counselors and we
Okay.
have counselors at psychology level, at financial level, at social level. So all these counselors are there with us to help us in taking care of the patients.
Thank you, Dr. Sushant. So coming to Dr. Kanika, Cancer also challenges the entire identity. From getting the news, now I'm not my person anymore. Now I'm just not the name or my designation anymore. I am a cancer patient. यहाँ पे identity का ऊपर वाला part attack होता है. Then comes with the process, the turmoil of chemo and everything. How it attacks the immunity, it attacks the strength, and it comes with the physical aches and pains. So, how do you deal with the patient's response to the consequences of this chemotherapy, especially जब उनका कुछ करने का मन नहीं करता है and the quality of life starts to decrease? Like, how do you deal with it?
I think first of all, congratulations. You have picked up a very, very sensitive subject, which we all know, which needs to be addressed. But we all face challenges in actually giving this holistic approach. Very rightly said by Dr. Shant that this is how it should be done. There should be a psycho-oncologist who should be integral part of our holistic care. But the practice patterns are very different in what happens in the West and what we want to do. In the West, it is the patient's privilege to decide whether anybody else should be involved in his management or not. Here it is the other way. The patient's attendants come running, colluding into your room and tell you, don't tell him or don't tell her she has cancer. So we are in a very, very different scenario. So we have to be very cautious. We are pushed actually to a defensive mode rather than we are, approaching for that help as a mental health issue. We first of all have to make it sure that entire family is coming in sync. So our job is made doubly difficult. You're coaching a patient or you're telling a patient who doesn't know he has cancer, but you still want to tell them what cancer treatment is likely to do to you. So I think dealing starts from day one. Dealing with physical or the mental issues gets easier if day one you have sensitized or walked through your patient through what is likely to happen in the future. So day one, when the patient comes, if the patient is aware of the diagnosis, you need to first inform them what are the treatment options you have, and then define and give them the accompaniments which each treatment would. For example, I'll just give an example of radiation. If I'm treating somebody with head and neck cancer, I would definitely tell day one that during the course of treatment, in the first week, you will encounter this. In the second week, you will encounter this. In third week, these are likely side effects, and the percentages may vary person to person, so that they are prepared. So before dealing, prepare them. They should come in the side effects should come to them in a way that they know, yes, this is what happens to everyone, and everyone goes through it, and it will be transient, it will be short lasting. And then you have to also be very sensitive in telling them that these are the side effects which we might be able to curtail, or the intensity will be reduced with our medication. So you have to reinforce again and again that whatever you will are likely to undergo, or whatever you are undergoing, is part of the treatment and is transient. And of course, you have to be very realistic in telling them. You cannot give very, very false optimistic hopes also, because then they get setbacks. Aapne to kaha tha, par aisa hua. So we really have to be very balanced in giving them that the outlook. When you talk of children, I think very, very different ballgame again, because first of all, you need to know what the child can take. You cannot throw everything at the person who's not prepared to take it. So first of all, you'll have to discuss with the parents to understand whether the child is aware and what sort of information child already bears about his or her own treatment. After their consent, that is what practically we do now. We talk to the patient, and we basically, rather than talking of the disease, I think we talk of the procedure, what to expect during treatment. For example, I do a total body radiation for little kids. So you need to tell them there will be a room, we will be seeing you from outside, mama can talk to you on the phone. So there are ways where you need to make it sure they are comfortable through the course of treatment, because it is very, very customized. Some children are very intelligent, they have asked questions, they are aware of what they want to know, whereas there may be some who get intimidated, they get scared. I will just talk of one child. I did PBI last week. This child was a very, very intelligent child. He went inside. I just told my resident, pedicloral mangalo, he'll require sedation. The child repulsively said, Ninni ki dawai nahi. He was so intelligent. He says, I don't want a sedative. So I said, what do you want? And amazingly, he said, I want Sumit Goswami's music in the chamber. So I wasn't aware who Sumit Goswami is. We Googled, YouTube, and we put them there. He sang through his treatment. So every child is different. So you cannot just replicate these formulas for all patients, but you need to understand the child's psychology first, what he can take. So don't embark everything you know on every patient you come across. So that is how I address my patients.
I am surprised and pleased to know that you are doing the counseling part so well. And
No, we have full-time counselors, but the problem is the counselor will have a session, but the real-time ground situation is when we are accompanying them in the treatment. So it is an ongoing process. We cannot debar or back out from our responsibility of counseling. The counseling which the psychologist does is definitely different. I always tell my patients what they do with you is not what I can offer to you, because there are so many exercises, diversion exercises, activities which can take out the negative thoughts or put you back to track. That a doctor cannot do. So we cannot fill in for each other. Yes, we can hold hands for the missing links at times.
Yes, absolutely. Like I 100% completely agree with you, and really pleased to see how step by step and very sensitively and carefully with the body, with the identity issues. Let's come to this was about how the chemo and the consequences impact the physical aspect of the radiation. Now comes when the surgery is needed. There are few cases where you have to remove the areas of the tumor. So in my experience, like I have not professionally experienced cancer patients, but in my personal experience, I've had one family friend who had breasts removed because of the breast cancer. And she was very concerned about how will I look afterwards, and I may have to attend few of social gatherings, and I won't be able to go. So should I delay the surgery? And a lot of body image issues and a lot of anxiety also comes along with this. So my question for Dr. Vijay is, what are the pre and post operative concerns and difficulties you come across with patients related to the appearance, related to body image issues?
Yeah, good evening. I must congratulate the organizer for organizing such a wonderful seminar, because most of the time as surgeons, many a time we forget the emotional aspect of the patient. We just concentrate on our surgeries. Dr. Kanika very rightly said that ultimately it is the treating physician who is most important counselor. And in my opinion, it should be one person only, the main lead, like a medical oncologist or primary physician, which should counsel them primarily, because ultimately the patient has to take all the treatment. And as far as concern telling patient, not telling the patient, of course, our patients are not that intelligent, but one should always tell the patient about the disease, but maybe in a little conservative manner, because ultimately it is the patient who has to undergo surgery or take chemotherapy or other radiation treatments. So how can you hide things from those people? Anyhow, somebody in the room will always utter a cancer word. So patient must, I think, know before undergoing surgery. So as far as body image is concerned, see, body image is not only a how do you look in the mirror or a how your physique is there. It's more related to your emotions, your environment, and part of the disease. And see, in the body image, most of the patients may be intelligent, may not be very intelligent. They are always worried about their body image, how they will look after the cancer surgery. After all, once we are doing a extensive cancer surgeries, sometimes we may not be able to achieve very good looks after the surgeries. Like most of the people, like ladies, females who are undergoing breast removal surgeries after cancers, they are most of the time worried how they will look, because ultimately breast is a symbol of femininity. So it is very important that we tell them that we can reconstruct the surgery, but things depends on so many other factors also. Which stage the disease is there, how his behavior, his social status, how is his financial status. That is also very important, because these days, like in India, We have around 70 lakhs patients per year, and out of that, uh, we have a very high mortality also. And most of the time, if we see, about 70% of these expenses are to be spent by the patient also. So that financial aspect is also to be seen. Then, while removing any organ, so we are concerned primarily for two things. One is a cosmetic effect, and other is a functional effect. Like in oral cancer, if we are doing a surgery for the tongue cancer, we do a glossectomy. Patient is always worried: will I be able to speak? Will I be able to take my food normally? If I go to my workplace, will people be able to understand me? So all these factors are very important. In the pre-operative, all counseling has to be done to them. Sometimes not very truthful. See, we have to hide many things. Okay, you will be all right. Although we know that there are many problems, but ultimately counseling have to be done. Similarly, with the breast thing, if we do reconstruct the breast, the results of the therapy are better. Patient accept the treatment in a better manner. Similarly, other factors, other cancers like prostate, ovaries, and they have so many effects like hormonal effects, physical changes. All those needs to be addressed in the pre-operative period. In the post-operative period, in the initial period, patient is actually not worried about this, how he or she will be looking. And immediately the post-op period, patient is more worried whether I will survive this surgery or not, whether I will come out of the ICU or not. Then as soon as he starts recovering, then the body images concept, they come up. So body image may concept may the problems may vary from up to 6 months or more, and people who are long-term survival, they carry the body image to a long time. Patient may be anxious, patient may be depressed, and they may not go to the workplace, or may hide themselves in the room, not talk to other people. So anxiety, depression, all those factors can come, and we have to counsel all those factors in the post-operative period as well.
Absolutely, sir. I completely agree that body image is not about how the person is looking, but how the person is feeling about the look.
Yes.
However distorted or maybe not according to their choice it is, but again, the counseling and the combined effort can help the of life to get a better quality of rehabilitation.
Definitely.
And apart from all this, there is one more challenge that I have observed is if a person gets any life-threatening illness, and for example, cancer, and to the population who is not well educated. So they start, and there is no reason about me. The person starts to question the reality, existential crisis हो जाता है. So in that, there's also one kind of stigma that किसी ने काला जादू टोना तो नहीं करवा दिया. Like, why did it happen to me? Why it has to happen to my family? So what is your opinion? Like, do you ever, this question is for Dr. Seema, ma'am. Have you ever come across any stigmas or any distorted conceptions from patients coming? Like, if there is no specific, where there is no specific cause to cancer, कि क्यों हुआ होगा ऐसा, लोग ऐसे confused रहते हैं. So, have you come across any of these stigmas?
Yeah, hi, good evening. And at the outset, I would like to congratulate the organizers for planning this event, and especially on a World Cancer Day. So, I mean, I have come across many myths that are common among cancer patients. And this is very common, that why me? Why I am affected? Why my family members are affected with cancer? Is it related to some eating habits, or is it related to some lifestyles? And nowadays it is very common that patients are thinking that if they're eating a lot of sugars, then probably they're getting cancers. And those who have been affected with cancer, they are completely eliminating sugar from their diet, thinking that if they will not take sugar, then cancer cells will starve of sugar, and then cancer cell will die. That will help to improve their outcome. So which is definitely not true. Another common myth which is seen in patients is that they think that any kind of herbal medicine, or like any homeopathy or Ayurvedic medicines, can be helpful to cure their cancer, or these medications can be taken to reduce the side effects of chemotherapy, which is completely not true. So I would urge to all the patients who are listening to this event that please do not rely on alternative therapies. Nowadays, cancer is curable, and it is curable if it is detected early. People think that if they're diagnosed with cancer, that means their life is finished and it is fatal, and the outcome is going to be fatal. So I want to stress here that diagnosis of a cancer is not a death sentence. It doesn't mean that you will not be cured of this cancer. There have been significant advances in the treatment of various type of cancer, and even in advanced stage of disease, patients are living on an average of 3 to 4 years. So treatment have improved, the outcome of patients have improved, but the most important factor in treatment is that they need to be compliant with the therapy. They have to take the treatment very seriously, follow the advice of the treating doctor, may it be medical oncologist, surgical oncologist, or radiation oncologist. So on-time treatment is the most important factor that will decide their outcome. So they should make all efforts to look into the fact that they get the treatment on time, and all required treatment is given at a correct time. There shouldn't be any delay.
The patient should be completely committed to the treatment and should establish a certain amount of trust with the doctor, I think. Yeah, commitment and trust is,
And
it's not just cancer, it's a really.
So there are some more misconceptions about the patient, which we see commonly. Many patients feel that cancer is contagious, that it can spread from one family member to the other if they share the same room or they are staying in the same home. So cancer is not contagious, it does not spread by touching or sharing the same room. There are some misconception about radiation therapy as well, that patient whom we advise that they need radiation therapy, patient have a fear that if they get radiation therapy, they might become radioactive and they might spread that radiation to their near and dear ones. So which is also not true.
Absolutely.
These are the common problems which we face every day in our OPD.
But the cancer being communicable, I am hearing this for the first time. Alternative therapies.
Commonly, we hear out from the patients where, basically, I practice in Mumbai. You all are aware that Mumbai has small houses. So many relatives who come and stay with them. This is more of the relatives they will ask if they are coming and staying in our home. Can we be affected with cancer because they are staying in our home? We have small houses, less aeration. So this is common myths which I have seen in patients.
From listening to all of these answers, I can sense I was trying to think if just in my immediate family of me, like what will actually a cancer survivor has to go through the journey, how painful it is. So while preparing for the talk, and I was actually just sitting and thinking about it, but after listening, and I came up with a lot of mental health conditions that could be applied in all these stages and in all these situations of the process. But after listening to all these answers, I'm like, there is a lot of confusion that first has to be clarified with the patients. काउंसलिंग का पार्ट और इमोशनल कंफर्ट का बात तो बाद में आता है, पहले ये सारी कंफ्यूजन को ठीक करना ज्यादा जरूरी है. And like there are so many issues and we have less time and we cannot like talk about each and every point. So yeah, Kavya, you were saying something.
No, I'm saying exactly, ma'am. There's so much information that you people can share with us, and there's so much that we need to learn and we want to, but just the shortage of time is making there's a barrier towards that. But Soul app is always welcome for you all. We will request you all to come on our platforms and talk about mental health, because there's too much stigma about it, and our country needs professionals like you all and breaking all the stereotypes and stigma about it. So as I said to our moderator, she's taking all the viewpoints from all of you. I would like to know a little bit of her viewpoint about it. And sorry, Kanaka ma'am, are you getting late for the webinar or another one?
There's some cameraman outside. I've told him to adjust the lights and set up somewhere else. I'll be there with you 5 minutes.
Okay, so so to all the viewers, Kanika ma'am has to leave, but ma'am, it was an immense pleasure for us to have you. And to all of you who don't know, but I don't think so. Anybody does not know the fact that Kanika ma'am is a radiational director, radiational oncologist. Everybody know that for sure. But I had to brought up that for all the viewers who don't have an idea about it. And thank you so much, ma'am, for being here. It was always a pleasure for Soul to have you.
It was pleasure listening to our colleagues. You know, we've been here working in different elements, and each one of us has a very different experience. We come from different cities, and I think the type of patients we see and the type of patients we deal with is so diverse that we will never have one solution. So it's so nice to hear from all of you. I think I was really happy to attend this. Thank you so much, all of you.
Thank you so much, ma'am, for being here.
Thanks.
So shall we resume the panel? I hope everybody is here. Yeah, as I was saying, ma'am, as you are a psychologist and you're especially concerned with trauma information counseling. So I just wanted to know, when you come up and meet up with a patient who is suffering from cancer and there's too much trauma attached to the person and there's a chance that he might die also. How do you console? How do you empathize to the person, and how do you deal with such things? And I just want to know, how does it feel?
I was expecting such a question, so I've already prepared a write-up for it. I was just jotting down the point that there is so much to talk about the fear, the panic to begin with. The anxiety stays throughout, and the reduction of physical strength, the reduction of self-confidence, and like बाहर जाने का मन नहीं करता है, कुछ करने का मन नहीं करता है, कितने सारे basic points है that has to be covered. So to begin with, I would like to read a few lines that I've written, which will kind of give you the idea, the lens to view how the person is actually feeling inside their body, how their mind and body are so dissociated and so scattered all the time. And then I'll come up with the counseling part. So it's a recipe for trauma and grief. We take one heaping cup of disbelief, of shock and panic when the first news is broken in front of the patient and the family members. When the patient decodes the diagnosis as death in their mind. So doctors are saying that it is purely curable, it can be treated well. But from inside, the person starts to believe, okay, this is something life-threatening, or I'll be dying, or what will happen after me, what will happen to my family members. Or if the news is broken to the parents about the child suffering from cancer, so what are those parents going through emotionally? Like they are just assuming कि we just have to बस अपने बच्चे को बचाएं किसी तरह. 1 tablespoon of reluctance to accept the news, as it takes a lot of visits to doctors to accept the news. जितना हम बार-बार विजिट करते हैं, जितना इस बारे में स्टडी करते हैं, उतना प्रोसेस में घुसते हैं और उतनी बात सेटल होती है कि okay, now we have a new normal. Now we have new better things to take care of. 50 kilograms of excruciating pain and never-ending medical bills. The pain and the medical bills never end. 2 cups of brutal sadness, followed by isolation, sleepless nights, loss of strength, and depression. 2 tablespoons of emotional fatigue for constantly pulling up with their willpower. With every chemo, I've heard that the immunity goes down, the physical strength goes down. There are so many aches and pains and the physical symptoms. So constantly, one thing that keeps up the survivor fighting the cancer is their willpower. Half cup constant anger and frustration of why me, and the lack of patience, like when will this end? By keeping the question why me and seeing themselves getting more and more dependent on the caregivers. Then 8 ounces of fear, guilt and shame. जैसे ही बाल झड़ने लगते हैं, the looks start to deteriorate. They kind of avoid going into social gatherings. They start to lose their confidence. And 1 cup of lack of self-compassion. We start to start hating ourselves, start hating our lives, because passively we are somewhere grieving around our life. हमने जो सोचा था करेंगे वो नहीं हो रहा है. Our major life plans are put on hold and they are kept aside, and the treatment takes the priority in the life goals. So now this was the ingredients, and the recipe would be: preheat the oven to 1123 degrees in a small bowl of mixed disbelief, shock, and panic. Then next, wash and grate the leaves of denial properly and grind the 50 kg sack of excruciating pain. The pain and the denial goes hand in hand. Heat in it in a hot heat it in a hot iron karai until it blackens and set aside. Now fill a large pot with tears of brutal sadness and shame, because somehow the survivors are not able to accept their reality. And whenever they have to step out, it's like, ये लोग क्या कहेंगे, मैं वहां जाऊंगी, क्योंकि सोसाइटी में पता नहीं है कि कंसोल कैसे किया जाता है, सपोर्ट कैसे किया जाता है in a emotionally comforting way. And even if the cancer survivor is there and people are supporting it, right, the survivor doesn't feel supported.
Exactly.
They are seen supported. So इसीलिए now fill the large pot with tears of brutal sadness and shame. Lower the heat and add 2 big tablespoons of constant anger, frustration, and emotional fatigue from keeping the willpower strong. Add another big tablespoon of intense fear and pain from chances of losing your loved one. Allow it to simmer for years, because cancer doesn't cure in a day or in a month. Cook it till the color changes to depression. Ultimately, cancer to cure ho jata hai, but it takes a lot of your medical bills, lot of your life. Your major life goals are replanned कि ऐसे नहीं अब ऐसे होंगी चीजें. Stir it well with the sleepless nights, migraines, and all possible painful side effects of the treatment. Layer the top with a garnish of reduced self-confidence and self-compassion. Let it sit for a lifetime of a new normal and impactful life lessons. जैसे ही आप न्यूज़ सुन लेते हो, आपको अपनी पुरानी प्रॉब्लम्स बहुत छोटी लगती है. And there is this new normal.
Sorry, I'm interrupting you. I'm extremely sorry, but we have reached the time.
Just 2 minutes.
For interrupting.
There is this new normal and new way of living, and a new way of learning how to sustain your quality of life, क्योंकि आपका lack of energy हो जाता है. तो उस बीच में आप जो चीजें करना चाहते थे वो तो नहीं कर पा रहे हो. तो अब आप क्या कर सकते हो कि आप अपनी एक वो होता है ना हैप्पीनेस लेवल थोड़ा सा मेंटेन करके रखो लाइफ में. And all of this, when it is cooked, serve it on a plate of hope, faith, warrior strength, love, and the constant support of your family and friends. So this was my little bit to let the audience understand what side of all the negative emotions, because the news of cancer comes with a buffet of negative emotions.
Right.
The family members and the survivor goes through, and it's a little journey about it.
Thank you so much, ma'am. All the viewpoints were highly appreciable and very insightful. So I would move forward, and I would ask my panelists to give me a signing off message. So I would like to move forward to Dr. Vijay Kakkar. Please, sir, give us a signing off message.
It was a very well organized seminar. I think at most of the time in this session we forget the mental aspect, which is very, very important. And patient must be counseled in a proper manner. Patient as well as his caretaker or his residents or her family all has to be counseled about the cancer, that this is nothing, we can treat it, we can make them better, and a positive attitude in the life has to be kept.
Thank you, sir. So for our audience, Dr. Vijay Kakkar is a senior plastic surgeon. I hope you already knew this information. I'm just giving it as a thing. And I would like to go to Dr. Seema Gulani, and I would like to hear her viewpoint on signing off message, ma'am, for our webinar.
So I would like to say that don't be afraid of cancer. Cancer is curable. Just take charge of your life and go with determination. Start your treatment, and I'm sure you all will be victorious. Yeah.
Thank you, ma'am. Ma'am, I have a question from you. If you allow, may I ask you?
Sure, please.
Ma'am, as you're such a senior person and such, you've been in this field for such a long time, I have this question in my mind. Ma'am, everybody talks about the patient psychology, everybody talks about how is the patient dealing. My question to you is, how do you feel? Because even a doctor has a heart, and dealing with somebody who's having such a trauma, you feel sympathetic about it. How is your mindset at that particular time, and how do you feel about it?
So it is tough. I mean, oncology itself is a tough branch, and if you do the Google search, you can find that oncologists are the most difficult. They face the most difficulty in treating the patient, as well as it is the most depressing branch, because you do not see the treatment results immediately. Like we see in cardiology, patient is sick, you start the treatment, patient will recover very soon. But this is not the case in oncology. It takes long time for the patient to recover. Patient has to go through a lot of trauma, physical trauma, mental trauma, and it is very tough for us also as a doctor to see the patient who are going through all this, right? And once we start treating the patient, as I told you in the beginning, that oncology takes a long time, cancer treatment are lengthy, and we have, I mean, I particularly deal with breast and gynec cancer, where the treatment may last up to a year or maybe 5 to 10 years for
Right.
maintenance hormonal therapy. So we also develop a rapport with the patient, we also develop a bond with the patient, and when the disease comes back and when we feel that there is no further treatment left after multiple lines of treatment, it is hard for us also, and it is depressing for us. So we have days when we see that many patients, they will come in crops, that 2 3 patients have come on the same day where they are not doing well. Obviously we feel bad, and that keeps hammering in our brain that what better we could have done for them, what best we could have done for them so that they can improve. And it is difficult to counsel them, to counsel their family members. It takes toll on all the doctors who are treating them.
So I would like to move on Dr. Before that, I would really thank the moderator, Dr. Sumedha. You were a treat to watch, and all the questions and the research that went into the questionnaire could be seen properly, because it was so nice. And when I was hearing your viewpoint, it was such a pleasure. And I think our audience would have never gotten a better moderator for you for the entire session. And thank you so much for taking the time, ma'am. I would really for that. So, Dr. Sushant, am I audible to you?
Yes, ma'am.
Yeah. So as you're a senior medical oncologist as well, I have a question to you, sir. Just like ma'am said, you keep on dealing with people, and being an oncologist is not a very easy field. It can get depressing, it can get cause stress, anxiety, and whatnot. So how do you take care of your mental health, because you're dealing with such a depressing situation here or the other in your career?
So I have developed a hobby so that I takes care of my stress. I talk to my friends, I do gardening, I go and take a vacation and to de-stress myself, unwind myself, attend conferences and to know how other people are coping up the stress. So this is how we try and take care of ourselves so that we are up and upbeat for the to take care of the patient. So we have to have our own sets of family, friends, and hobby, and movies or music. Something should be there to unwind ourselves. So that's how we do it. That's how I do it.
Do doctors feel comfortable visiting psychologists?
Yes,
Do
absolutely.
doctors feel so? Okay.
Yeah, because unless until we it's not that visiting a psychologist is something related to the brain or something there in my brain. It's just about sharing with someone and getting to
Mhm.
know how to deal with it. So it's not an issue at all.
Mhm.
So, Dr. Bridges, I have just one last question for you. I know you all have such a busy schedule and you've taken time out for us. But if you allow me, may I ask you one last question if you're okay with it? I know you have such a schedule. So am I audible? Vijay, sir, am I audible?
Yeah, you are audible. You can ask a question.
So, as you are a plastic surgeon, and I think a plastic surgeon is somebody just like God gives us an image, a plastic surgeon also gives us a new image. How do you feel to gain the power and you have the capability of changing a person's life when he has suffered from a trauma and you make him forget about it? How does that feel, sir? And people come up with an body image issues, oncologist issues when they go to the oncologist, their treatment is diagnosed, they have to suffer from some or the other body changes. How do you take that in your life, and does that affect your mental health somehow or the other, meeting such patients all the time?
Mental health, like Dr. Shrant said, we have to keep ourselves busy. I am more of a spiritual person, so I take my vibrations from Almighty. And as far as patients are concerned, it always feels good if you can give some good life to the patient, make his life more happy, more comfortable, and so that they can just go into society and present themselves. They can improve their body images. Reconstructive surgery in a cancer is a little different from the aesthetic surgery.
Right.
So in aesthetic surgery, we try to achieve supernormal things, but in a reconstructive surgery, we are trying to achieve normal things. Like if you have put a oral cancer, we put some kind of flap, although it will not look as good as a normal person is there, but he can assume his functions, he can eat normally, he can look normally, he can, his saliva will not be drooping. So all these factors are important. Similarly, in a breast reconstruction, if you can give a good looking breast, you are restoring the femininity of the lady, his sexual life may be back to normal again. So all these factors are very, very important.
Right. And once along, I would like to thank each one of you, our moderator, our lovely panelists, to be a part of our event and making it such a success. I think our viewers have been enlightened so much and they have gained so much knowledge about mental health and cancer. Thank you so much. And Soul app is always asking for your inputs and welcoming you on our platform. Thank you so much for being a part here. I
Thank,
hope you have a great time.
Thank you.
Thank you.
thank you for organizing a wonderful seminar.
Pleasure is all ours, sir.
Thank you. Thank you so much.
Thank you for
Thank
this
you.